Okay, so this is the conclusion. We've gone over all three categories. Now remember, like I said at the beginning tonight, you are the front line of HIV care. You're the one the patient sees the most. You're the one who talks to the patient the most. You're the one who you need to reach out to and hold their hands with the most. You are the number one person for them. So as you learn about these managements, we've learned you might get some side effects, but we also might be able to manage through those side effects and diminish them for the patient. Sometimes we may have to switch drugs, but guess what? If we can keep the patients adherent to medications and keep on therapy, they're going to have a much better quality of life. So you are the major component for that, and you're number one, especially if healthcare is becoming more prominent in the U.S. So let's go over our test questions. Now we're going to point you out, so either you can yell out the answer or I can pick on you. So which one do y'all want to do? You want to yell it out together, or do you want me to pick on somebody? Yell it out together. Okay, so internet people, you're off the hook. They're going to yell it out. So y'all yell out at home. What are the potential adverse effects of a tripla? Now I'm going to say 1, 2, 3, or 4. It is 3, and that is the correct answer. Congratulations. It is dizziness, drowsiness, rash, vivid dreams, remember of Angelina Jolie or Brad Pitt or me, and nephrotoxicity. Okay?
So number 2, which of the following antiretroviral regimens would most likely cause pancreatitis? So we have 1, 2, 3, or 4. So who says 1? 1. Everyone agree? Anyone disagree? No, right, good. So 1, didanosine. And the last question is, which of the following statements are true? So is it 1, number 2, number 3, or 4? 3. Very good. So Sestiva may cause drowsiness and dizziness, which generally gets better after about 4 weeks. So I think you guys did very good. You passed that part.
Okay, yay, this is the end of the class. Now, are there any questions from the internet land or people here in Atlanta tonight?
Actually, we don't have any questions yet from the internet, but I did overhear one in the room who may or may not want to ask it, so I'll ask it for them. They were interested in why Manish said it was not recommended to breastfeed.
Okay.
All right, well, HIV, you know, can be transmitted in different ways. So one of the ways it can be transmitted is through breast milk. And that's the main reason why you don't want to breastfeed.
Any other questions from the internet land? No? And from the group? Listen, y'all, we want to thank y'all for coming out tonight. We really, truly appreciate it. We really take it as an honor that y'all come out every time we do one of these classes. And we really want to thank you. Do not, hold on, Daniel's raising his hand again.
We do actually have a question now from the internet.
We love internet people.
There's a question that says, are there any government assistance programs? Very general question.
That's a good question. To pay for the antiretrovirals, yes, there are. We actually, every state has the AIDS Drug Assistance Program. You'll have to check with each state to see how that runs. Here in Georgia is the Georgia ADAP program, and all antiretrovirals are covered. So if you qualify financially, you meet the financial criteria, then you actually can get assistance that way. Also, besides the government, can y'all hear me? I'm going to do this right. Also, besides the government, you also have the drug companies themselves. The drug companies have patient assistance programs and can do that. One of the things we also do is you can find Ryan White healthcare clinics. Ryan White can help cover that. It's another government program. And, of course, there's Medicare Part D and Medicaid. So Medicare Part D, if you have Medicare, that red, white, and blue card. So those are all different ways you can get the medications paid for. And if you have private insurance, then you can actually contact the drug companies or your doctor. There's copay cards from the drug companies that helps you pay with the copays. And that's real important, too, even with people with private insurance. So there's lots of different ways that they can help you out.
And we have actually 2 more questions now from the internet. Does peripheral neuropathy and lipodystrophy go away completely when the offending medications are stopped? That's the first one.
All right, so does the neuropathy and the lipoatrophy go away? It does not go away completely. Certainly when we switch these medications or DC them, we can prevent further escalation of it, yes. The pain, again, can be managed relatively with the medications we're using, but yeah, again, it doesn't completely go away. What was the second question?
The second question is do you have any suggestions for the management, and I'm going to butcher this, I'm sorry, Lomtil and loperamide-resistant diarrhea?
Lomotil and loperamide-resistant diarrhea. Well, after that, people have used drugs like tincture of opium, fiber, yes. Certainly, again, if it's a medication and we still haven't controlled it with fiber and some of the opiums, then again, we could try to switch the medication to something that causes less diarrhea. Sometimes using a combination of both the Imodium as well as the Imodal tends to help, like scheduling it at off times.
On the zidovudine, you suggested promethazine, but it's very sedating. What about ondansetron, since it's generic and less expensive than it used to be? Is it an alternative for the nausea?
That's a great question too. So ondansetron or Zofran, as you know, was a product that was used mainly for chemotherapy-induced nausea, vomiting, as well as surgical, post-surgical associated nausea, vomiting. Now, with zidovudine, I'd have to look back, but I haven't seen any studies really that say that it's helpful or not. On occasion, we have used Zofran or ondansetron for our patients with mixed results. My experience is that after phenergan, if that doesn't work, then we've tried compazine. But again, that still can be sedating. And then if that doesn't work, then certainly we can give the Zofran a try. Or even Reglan is another product that we've used before as well.
We have a suggestion from the internet, and maybe you can comment on this. I'm guessing this is back to the diarrhea, saying banana flakes may assist.
Yeah, that's
Hey, we learn from everybody, so you can always try.
increases fiber.
Any other questions from the crowd? Any others? Speak now. Anything from the internet, Mr. DJ Daniel? All right. We also want to thank Farah. If you go to the website and you see all the website, it's Daniel at Farah LLC that actually does all our website design, all the testing design. Let's give a round of applause for Daniel because he does a great job. And his lovely assistant, Jason. Thank y'all. Y'all are wonderful. We really appreciate it. Thank y'all, and that's it. And you have a safe trip going home. Good night.